Nurses win historic AI protection contract. Did you know that hospitals are secretly replacing nurse decisions with AI? Well, not anymore because thousands of nurses just fought back and won. Today, I'm sharing a groundbreaking story that's changing the future of healthcare. Nurses at 17 major hospitals just scored a massive victory against unchecked AI in medicine, and this affects every single one of us who might end up in a hospital one day. Let me paint you a picture of what's been happening in hospitals across America. Imagine you're sick, really sick. You're lying in a hospital bed, and instead of a nurse using their years of experience to make decisions about your care, a computer algorithm is calling the shots. Sounds scary, right? That's exactly what nurses have been worried about. But here's where things get interesting. HCA Healthcare, one of the biggest healthcare systems in America, just had to back down. Their nurses fought back against AI taking over their jobs, and they won big time. We're talking about a contract that could change everything about how AI is used in hospitals. Now, you might be thinking, wait, isn't AI supposed to make everything better? And that's a great question. The truth is, AI in healthcare is kind of like a double-edged sword. On one side, it can do amazing things like spotting patterns in X-rays that human eyes might miss, or helping schedule patient care more efficiently. But on the other side, it could also make dangerous mistakes if left unchecked. Let me break down exactly what these nurses achieved, because it's pretty incredible. These contracts affect 17 different hospitals across 6 states. We're talking about thousands of nurses and potentially millions of patients. The nurses didn't just say no to AI, they made sure they got a seat at the table when it comes to how this technology will be used. Here's what the new contract actually guarantees. 1. Nurses must be consulted before any new AI system is implemented. 2. AI can't override a nurse's professional judgment. 3. Patient care decisions stay in human hands. 4. Regular reviews of how AI systems are affecting patient care. But why is this such a big deal? Let me give you some real-world examples of what nurses were worried about. Imagine an AI system that decides when patients should be discharged from the hospital. Sounds efficient, right? But what if that system can't pick up on subtle signs that an experienced nurse would notice, like a patient's unusual anxiety or slight changes in their behavior? These are things that could mean the difference between a safe discharge and a patient coming back with serious complications. The nurses at HCA Healthcare were seeing some concerning trends. They noticed more and more decisions being handed over to algorithms without proper testing or oversight. It's like putting a robot in charge of your grandmother's care without making sure it knows what it's doing. Not exactly comforting, right? Here's where it gets even more interesting. HCA Healthcare isn't just any hospital system, they're one of the largest nursing employers in the entire country. When they make a change like this, other hospitals pay attention. It's like when Apple makes a change to their phones, suddenly everyone else in the industry starts following suit. Let's talk about what this means for you and your family. Whether you live near one of these 17 hospitals or not, this contract sets a precedent. It shows that healthcare workers can successfully push back against technology being implemented without proper safeguards. It means that the next time you or a loved one is in the hospital, there's a better chance that important decisions will be made by actual humans who can see the whole picture. But it's not all about fighting against AI. The nurses and HCA actually found a really smart middle ground. The contract recognizes that AI can be incredibly helpful when used correctly. Think of it like having a really smart assistant. It can help with paperwork, scheduling, and spotting patterns, but it shouldn't be making the final calls about patient care. An HCA spokesperson actually said something pretty interesting about this. They talked about wanting their clinicians to focus on what they do best, taking care of patients. And they're right. The goal isn't to get rid of technology, it's to make sure it's helping rather than hindering patient care. The contract is set to last for 3 years, which is pretty standard for these kinds of agreements. But what's not standard is the language about technology and AI. This is completely new territory, and it's fascinating to see how it's being handled. Let's look at some specific protections in the contract. Nurses must be involved in the testing and implementation of new AI systems, regular evaluations of how AI tools are affecting patient care, clear guidelines about when human judgment takes precedence over AI recommendations, protection against using AI for staffing decisions without nurse input. This is actually pretty revolutionary stuff. Think about it, these nurses aren't just protecting their own jobs, they're protecting the quality of healthcare for everyone. They're making sure that when you're in the hospital, you're getting the best of both worlds: advanced technology and human expertise. The National Nurses United, which helped negotiate this contract, made a really important point. They said this isn't about resisting progress, it's about making sure new technology actually enhances patient care instead of diminishing it. And honestly, that's something we should all care about. Let's put this in perspective with some numbers. 17 hospitals affected, thousands of nurses covered, 6 states involved, 3-year contract duration, countless patients who will benefit from these protections. But here's what makes this story even more important: it's probably just the beginning. As AI continues to develop and expand in healthcare, other hospitals and healthcare systems will likely face similar challenges. The HCA contract could become a blueprint for how to handle AI in healthcare settings across the country. So what's the takeaway from all this? Well, it's actually pretty simple. The future of healthcare isn't going to be either all human or all AI, it's going to be about finding the right balance. And thanks to these nurses, we're starting to see what that balance might look like. This contract shows us that it's possible to embrace new technology while still protecting what makes healthcare human. It's about using AI to enhance, not replace, the incredible work that healthcare professionals do every day. And you know what? That's exactly the kind of healthcare system we all deserve, one that uses the best of technology while keeping human judgment and compassion at its core. The next time you hear about AI in healthcare, remember this story. Remember how a group of nurses stood up and said, yes to progress, but not at the expense of patient care. Because at the end of the day, that's what really matters, making sure that when we're sick or vulnerable, we're getting the best care possible, whether that comes from a human, a computer, or ideally, both working together. Hit subscribe to stay updated on the latest developments in healthcare technology and patient care.